Okay, let's go ahead and start letting people in. Good afternoon, everyone. I think we're going to have a minute or two of people flowing in from the waiting room, so we'll get started in just a moment. Welcome. Good afternoon, everyone. Looks like we still have a pretty steady flow of people coming in from the waiting room. So we'll just get started in a couple of moments. Make yourself comfortable. Happy Monday. Okay, well, welcome. Let's go ahead and get started. Good afternoon. My name is Emma Goforth, and I'm the Mental Health Policy and Promotion Manager at Tri-County Health Department. Welcome to everyone who came back from day one of the summit, and also welcome to those who are just joining us. We'll go ahead and do a quick overview of what we're doing today, a little brief recap from day one, and then we'll jump right into our presentations. So here's a summary of the agenda today. We'd really like everyone to please enter your name, organization, and role in the chat so we can start to welcome and get to know each other. The agenda here is today we will have a break, hopefully about halfway through, so you all can refresh and come back re-engaged. And we will be sharing slides and recordings for all of these sessions going forward. So you will have all the materials. We started last week with a really nice welcoming from Grace Solon, who is our Health Equity Manager at Tri-County. And while she's not back today to give us her nice rousing speech, I did want to bring these questions forward. So she posed these to us. These came from the Tri-County Internal Health Equity Action Team. And I just wanted to put these forward for us to consider as we move into the day-to-day. So thinking about equity and inequities existing around the issue. We always want to encourage the exploration of unintended impacts, greater burden, or those who may be left out, and to be aware of those. And also if any groups might disproportionately benefit from this decision. And if the folks that we are hoping to influence or affect have been informed, involved, and represented in our decision-making processes. We'll talk a little bit more about that later. And can our findings and lessons learned be incorporated into other related processes to advance equity? So just a kind of grounding reminder for some of these questions in going forward. And so hopefully many of the folks on the meeting today were able to attend day one last Monday, February 28th. If you were not, we will be sharing the slides and the recording for that event after today. We spent a fair amount of time doing a brief review of assessments, resources, and tools that we think can really help us to advance the mental health and suicide prevention frameworks. We'll go over a summary of the themes that emerged from some really great discussion last time, and we will use those themes to really guide our discussions and our further work today. I will say that as we left day one, there was a little bit of a ambiguity that we ended our meeting with. So we spent a lot of time talking about how we might hone in our priority focus. And what we'd like to do today is propose that we start with a focus on suicide across the continuum of mental health and suicide prevention. We'll review what that means again and use that as a starting point. And this will become a little more clear as we get into the presentations and activities, but just wanted to put that right up front. And really our goal starting on day one and as we roll into day two is to help us all feel confident and understanding of our shared roles in supporting, building, expanding collective work towards our vision of a positive mental health and well-being and a suicide-free community. So again, if you're interested in the details, you'll have a recording available to you. That's going to be available very shortly after today's meeting. But what we'd really like to do today is start off with some data. So here in public health, we always root and ground ourselves in this. And this is an area that we did not have time to dive into last week. And we're very pleased to welcome Adam Anderson, who is from our planning and information management team. I just have to think about acronyms. You guys know that about me now. And so he's going to do a really quick run through of data, and I'll hand it over to you, Adam.
Thanks, and thanks for having me. As Emma said, I'm the interim director of our Planning and Information Management Division here at Tri-County, and I oversee all of our health data and analytics. And so what I want to do is just go over a quick overview of a lot of our common mental health data that we have. And I was putting these slides together thinking I was going to just highlight some key takeaway points, but then thinking it may be helpful to just include a whole lot of slides that may be useful in the discussion today. So Emma will be posting a link to where you can access all of these slides, and thinking that a lot of these, I won't cover them in detail, but it may be useful in terms of further conversations later today. So what I do want to focus on in terms of the main takeaways are kind of related around the data sources themselves. So just a lot of times what we tend to look at right away are mental health status in adults, and we get that from our BRFSS, our behavioral risk factor surveillance data from CDPHE, and then youth mental health status. And then the second one, I want to focus on suicide mortality coming from death certificates. And then what I find really useful, rather than just like the rates and counts that can be kind of make it very, it doesn't, it makes the data feel a little disconnected from what's actually happening. And so I think circumstances around suicide coming from our NVDRS data is very powerful in terms of connecting this to the work that programs are actually doing. So right off the bat, this is mental health status in adults from the Behavioral Risk Factor Surveillance System. And generally what we look at are individuals who are reporting not good mental health for 14 or more days in the past month. And this is for adults. And when we look at the past 5 years, we can see sort of an incremental increase from 2016 to 2020. I can't tell you actually if it's statistically significant or not. Usually we don't get those kind of dramatic trends in BRSS data, but we do see a definite progression from around 8% of individuals reporting 14 or more poor mental health days in the past month to over 10% at this point. And this is aggregated by the county, and you can see that Adams and Arapahoe County generally fall in line with what's happening in Colorado overall. However, when we look at that, when we stratify by different demographics, we can see that in both Adams and Arapahoe County, individuals making less than $25,000 a year had twice the rate of poor mental health as compared to those making over $50,000. For individuals reporting LGBTQ status, they are 2 to 4 times more likely to report poor mental health as compared to those who are reporting straight as theirs, or identifying as straight. And so you're talking about 14 compared to 60%. Specifically in Adams County, Black individuals are reporting much higher rates at around 28%, while Hispanics are reporting actually lower rates of poor mental health. And then in Arapahoe County, other non-Hispanic races, so these are self-reported, so other non-Hispanic plus American Indian, Alaska Native are reporting higher rates compared to the entire population. Next slide, please. So there's been this question of what's been happening with mental health due to COVID in the past couple of years. And so the CHI has, in their Colorado Health Access Survey, had started asking about that. And we can see that roughly 35%, if you look at the metro area as a whole, roughly about 35% have experienced a decline in mental health, such as anxiety, depression, loneliness as a result of COVID. Next slide, please. And then in terms of individuals who are experiencing poor mental health and are looking to get care, who are not able to get care, roughly 12% across the metro area have not been able to receive care who wanted to get care for mental health issues. Next slide, please. And then these are the numbers specific to Adams and Arapahoe County in terms of receiving care and mental health issues due to COVID in the past 2 years. Next slide, please. So then when we look at youth mental health, generally, so the one data set we have consistently is the Healthy Kids Colorado survey, and that's done every other year. And we generally look at this cascade of feeling sad or hopeless, which is on the far left-hand side, individuals who thought about suicide, and then the next set of graphs are the individuals who made a plan, and then the next one over is individuals who have attempted suicide within the past 12 months. And so we can see this progression from left to right. And so roughly anywhere, so around 32% for Adams, Arapahoe, Colorado, have felt sad or hopeless where they've stopped doing usual activities every day for 2 or more consecutive weeks in the past 12 months. And then all the way to the right-hand side, we can see that 7 to 8% roughly of students who've attempted suicide in the past 12 months. And these have not changed dramatically from prior years where we've looked at Healthy Kids Colorado survey data. Next slide, please. So when we look at those by sexual orientation, we can see that for individuals reporting bisexual, gay or lesbian, or unsure, they have dramatically higher rates of feeling sad or hopeless as compared to their heterosexual counterparts by, in some cases, 3 times. Next slide, please. And then when we look at the same indicator by race ethnicity, we can see that varies based on what county we're talking about. So specifically, if we're looking at, say, Asian non-Hispanic, you can see for Adams County, it's quite a bit different than Arapahoe County. And so there's certain factors at play that we could discuss later on if we have time. But we can see some general trends, though, with mixed race, Hispanic, Latinx, as compared to, say, their white counterparts. Next slide, please. And then when we look at individuals who've actually attempted suicide, again, there's dramatic differences by those individuals reporting bisexual, gay or lesbian, or unsure. Next slide, please. So next, if we're looking at suicide data from our death certificate data, in 2020 in Adams County, 116 deaths were reported as suicide-related deaths, and then 118 in Arapahoe County. And we can see that it's a little bit bumpy, but overall we can see that the trend since 2010 has steadily increased as well. So this is looking at rates, and so we've gone from essentially the low to mid-teens to the low 20s. Next slide, please. And then if we break that up by age group, we can see it becomes harder to see the trends just because once you chop that up into smaller numbers, it gets a little bit bumpy. But we can definitely see increases in specific age groups, and particularly in older individuals. And it's hard to see some of the trends in the youth, but in youth as well, so under 18. And then when we look at that, so at the top, the orange category is 15 to 44, but that's been an age group of interest. So we've broken that down a little bit more. So in the graphs below, that 15 to 44 age group is broken up into 3 different groups. And again, some of those trends are harder to decipher just because of the smaller numbers, but those are there for your reference as well. Next slide, please. And then these are just specific demographic stratifications by age group, by county. So suicide related deaths. And again, you can see those counts increasing over time, and then just the demographic breakdowns by age, race, ethnicity, male, female, and veteran status and marital status. And you can see one of the trends we do see overall is just they're quite usually about what am I trying to say? 80% are generally males. We see quite a few in that kind of 18 to 45 category, but we've been seeing increases in youth and in older adults as well. Next slide, please. And then this is for Arapahoe County. Same apply there. Next slide, please. Sorry, I'm trying to get through these pretty quickly. And then we have a handful of suicide mortality density surfaces here. So you can see on the left-hand side totals for Adams, Arapahoe, and Douglas County. And then if you just click through the next couple slides, this is 2014 to 2015, and then I think there was one in between there, but it ends. So maybe we. Oh, that was just titled wrong. Sorry, apologize for that. This is 16 through 17. You can see that on the left-hand side, and then the next one will be 2018 to 2019. And so you can see where we have higher density or clusters of suicide-related deaths. Next slide, please. And then, finally, what I generally find most useful when it comes to programmatic work and actually trying to assess what can be done about this would be the circumstances around suicide related that we can get from the NVDRS. So it's the National Violent Death Reporting System that's run out of the Vital Records program at CDPHE. And it looks at all of the circumstances around individuals who have died by suicide. And what we can see, and this generally applies, this is pretty consistent across all suicides in Colorado. But I have this slide for Adams County and the next slide for Arapahoe County, but we can see that generally if we go back to Adams County, sorry, about 60% have been currently diagnosed with some sort of mental health issue. They're currently feeling depressed, had history of suicidal thoughts. There are a substantial portion, so anywhere from 30 to 40% with alcohol or substance abuse issues prior to suicide. And then about 25 to a third of them have some sort of issue with either a financial issue, something related to their job, or family issues. And then, so those can be, you can see those in the breakdown. And sorry, some of these are somewhat abbreviated, but I think you'll probably be able to figure out what each one of those is referring to. And then also you can see substances. So there are a very large percent with alcohol-related issues, and then other substances in general. And then next slide, please. If you look at Arapahoe County, you can see that the same general trends apply for Arapahoe County as well. Next slide, please. And then same thing for youth. Sorry, this is not from NVDRS, but I think it's from the I can't think of the
Child Fatality Review team.
Yeah, thank you. And they look at circumstances around youth-related deaths as well. And so, but you can take a look at that. And then next slide, please. And then we have that for Arapahoe County. And then at the end of this, there are a handful of bar graphs. Sorry, I'm just trying to finish up quickly so we're not running out of time. But there are several graphs that further break down some of the youth-related Healthy Kids Colorado mental health indicators.
Adam, I think it's okay to go through these quickly. I think we can take some time, and then we'll just have a few minutes for questions.
Okay. So in the same way that we were looking at some of those, so remember those 4 indicators for that cascade up all the way from feeling sad or hopeless to actually attempting suicide. These further break those down as well. So by race, ethnicity, we can see we have in the case of percent of students who seriously considered attempting suicide, we see that Hispanic of any race have a higher rate compared to, multiple race or Hispanic Latinx have a higher rate compared to their white, Black, and Asian counterparts, with the exception in Adams County. And so this is where I think that depending on what, if you're working in a specific geographic area, that some of these differences definitely need to be considered when addressing solutions for this, because there are, without, in my own personal opinion, that we have pockets of different groups of people, and there may be more support for, say, a specific community within different counties. There may be different supports at schools. There are a whole slew of different reasons. I think that's why you all are here, to talk about those. But I think looking at these geographic differences is critically important, and even determining solutions. So what's happening in Arapahoe County around the Asian community specifically, as compared to, say, Adams County. And so we could do that for any of these sort of dramatic differences that we see. Next slide, please. And then the percent of students who made a plan about how they would attempt suicide during the past 12 months. Again, we see that one's really interesting. I've not actually dug into that. Usually we don't see those kind of that dramatic of a difference as far as that Asian non-Hispanic showing up in Adams County, but it's definitely something to reflect on. Next slide, please. And then the percent of students who actually attempted suicide one or more times. Again, we can see that the lowest tends to be in the white non-Hispanic, and then mixed students of color and mixed race kids tend to suffer a disproportionate burden when it comes to that. Next slide, please. And then again, when we look at LGBTQ, this is always kind of this is the number one sort of driving, in terms of low-hanging fruit, this is the number one kind of disparity that we see as far as those who identify as bisexual, gay, or lesbian or unsure are 3 to 4 times higher in terms of just mental health status, thinking about suicide, and attempting suicide. Next slide, please. And so, yeah, the same thing applies here in terms of making a plan. Next slide. And then, okay, so that's your set. So I don't know if we have time for any questions, or if you're, if you all just want to move to the next agenda item.
Yeah, Adam, I think we can open it for just a few minutes of questions. I don't see any in the chat, but just to help others reorient to the Zoom platform, you are welcome to put questions or comments in the chat. You're also welcome to come off mute and ask questions directly. We will be giving, in fact, I'll do this now while we're waiting for questions to come in. I'll give you a link to the PDF of this data. We thought that it might be helpful for you all to have on hand so that you can refer to throughout the day as we do our breakout groups and activities. And then, of course, we'll be sharing all of this information post-meeting as well. Any questions or observations that anybody would want to bring forward? I see Tia.
I may have missed it, but was there a specific reason where there was a column missing for the Adams County group for Black individuals experiencing a mental health issue?
Sorry, can you go, Emma, can you go back to that one? It may have been that was suppressed due to response, but let me double check on that one.
Sorry.
some of these, if we don't get enough of a response in any given category, we can't generate a reliable estimate. But I can double check on that for you.
Yeah, that seems to persist through pretty much all of the Adams County data.
And I apologize for having to run through it so quickly. I feel like sometimes it does a disservice but I did want to get enough information in the slides for you all to be able to reference it later.
Oh, thanks for putting in the prompt, Callie. So we do also have this data and a few other sources as well on our website. So you're welcome to do that. If you go to the dashboard on our website, you can hover over the various indicators so that you can see the full description of the types of questions that were being responded to that we weren't able to show on the screen. I see a raised hand from Steve.
Yeah, if we could also follow up and get that data added when you post it, I think that's important. I mean, the whole reason we're having these breakouts of different demographics is to look at things holistically as well as across different intersections. So if you guys could please make that a priority, or let us know why it is not included, so then we could try to address this issue in the future.
A lot of times in our survey data, we do have missing data from just when we don't get enough responses to calculate a reliable estimate.
Well, then maybe let's find out why. Maybe in the collection of data, was it not representative enough? Did we not do enough outreach? Did we not reach out to the right folks? Like when we say that there's a missing piece of data, it always creates some concern for us. And it also exacerbates the concern and lack of trust that folks in our community have with government and trying to collect data. So if you guys could help us out, I appreciate it. And particularly, I'm a county commissioner in Adams County, so I don't like that being how it looks. So thank you.
Sure.
Yeah, I'm going to make a note of that. So the Healthy Kids Colorado survey, in terms of collection and what questions get asked and where, is a complex topic. We could probably have a whole hour just on that. But I would love to make sure that we provide both some follow-up in the email that we'll send out after the meeting, but maybe also explore a little bit more about these conversations that we may need to have regarding data that's missing or that is not telling us, the stories of our communities.
Well, we have relationships that can help you with reaching out. We work with organizations and partners in the community. So thank you.
And a lot of times that may usually with these sort of survey type thing, data sets similar to the BRSS, it requires an intentional oversampling of a certain population if the population is underrepresented or too small in that community.
Mm-hmm. So I see a few questions here in the chat. Nate, I see your question about the age breakdowns, and we can follow up with that. And I think from
Robin has a
here,
question.
The question was, sorry, I'm scrolling up and down here. Is it possible to get data broken down to a school age category 5 through 18?
I can just jump in and clarify. I think part of the challenge for us as schools is we want to measure right as well. And so I think when I've looked at the state data, you can get 5 through 14, and then you get 14 to 24. And that it would be really helpful if we could somehow get 5 through 18. So at least we could kind of see impact that schools might be having on that 5 to our school age range, or even 5 to 21. So just, I don't know if the state's able to do that, but that would be really helpful.
These data actually represent high school aged. Oh, Callie had already put that in there.
Oh, I'm talking about the state vital stats data, not the healthy kids.
Oh, okay.
Yeah.
So
And I see a hand raised from Robin Winters too. Did you want to respond real quick, Adam, or is that something we want to do in our response?
sorry, I didn't catch that. Robin, do you want to just ask your question? Sorry.
Thanks.
Oh. You may still be muted.
She's going to chat it in. Very good. All right. Well, so we can await that, but also I do think we want to kind of move on. I think these are wonderful questions, really important for us to be considering. And, you know, again, really meant to be sort of a snapshot of some of the issues that we may want to have ourselves attuned to as we move into discussions about how we may work together. But I do think that there's very likely to be some collective, you know, need for us to come back together and have a deeper dive into the data. And in the meantime, we'll try to respond to some of these questions in the short term. Yeah, and there's some good commentary in the chat about how Healthy Kids Survey is done and how it's been administered. So I think we'll go ahead and move on. And thank you, Adam. Appreciate your support here. I did put into the chat the link to the data PDF. So you're welcome to take a look at that. And we can you know, make sure that you also have these in an email format after the meeting. But we'll go ahead and move into the next part of our presentation. But know that we'll have much more opportunity to revisit some of this information. So the next part is really just to do, again, some foundation setting for the group around why we're having this group all come together. Oh, Robin, I see your question now before I launch into that. Thank you for persisting with that. Adam, so the question, is there an explanation for the Asian group being so high in Adams County?
Yeah, can you hear me now?
We can hear you now.
Okay, good. Sorry, my battery ran out earlier. So that, yeah, I was just, there's just such an alarming rate of height in Adams County, particularly towards the Asian population there. And do we know why that is going on? I mean, it's just such a big difference there.
Yeah, I don't. This is actually I've been so involved in COVID data the last couple of years. I really haven't had time to dive into this. So this is actually, unfortunately, one of the first times I've really been back into looking at these metrics. But I don't know why that's so much higher all of a sudden. And
Well, I have a youth board, and I have Asian members on my youth board for adolescent behavioral health stuff. And I know they'd be particularly interested in this data. And these are all Adams kids, 12 kids. So I'd love to follow up with you guys about this, because I know these kiddos are very big advocates for wanting to change this, particularly for their raised population. So
yeah,
I'd like to find out more. Adam, I'll follow up with you later. Thank you for.
I think what makes it all the more dramatic is when we look at Arapahoe County, the Asian indicator is actually much lower than the rest of the race stratifications.
Yeah.
So
what are they doing right?
Yeah.
To be better supportive? I mean, none of it's good, because all the numbers are higher than any of us would like to see, but it's just particularly high in Adams, and I was interested. So anyway, I'll follow up with you if it's okay, Adam. I'd like to follow up with you or someone from your team a little bit more about that.
Sure.
For my youth, to try to help.
Yeah, of course, I'd be happy to.
Yeah, and keep that in mind as we get into some of our breakout groups. So some of what we hope to do today is to refine some short-term actions for this group to work on together. And I think that if there are data questions, especially better understanding what's happening in our communities, that may be a very appropriate short-term action for us to prioritize to do some more assessment outside of the surveillance systems that we have available to us. There's lots of opportunity to do qualitative data collection as well. Okay, so as much as we can geek out on data all day, I think we're going to go ahead and move forward. But thank you all for engaging in this initial discussion, and thank you, Adam. So we're going to go ahead and jump into some basics around collective impact, just to help us think through why we're all here together and what our opportunities are. And so this is nothing that none of us, are not aware of already. Our communities are quite unique, and especially when you really look at across Adams and Arapahoe County, the diversity and the various segments of our community can really vary quite a lot. And so as we think about that variation, it just underscores how important it is for us to have community-driven strategies and promote approaches, and that we all need to work together in partnership for these arenas. So coalition building as a tool. So again, we recognize that for complex issues, we need to have more sophisticated responses. And for that, we need individuals and organizations to really focus around a common interest and a common goal. And the purpose for this, rather than us all just kind of taking our individual parts, are to help us address the urgency of a situation, to really engage the community as a whole, to improve or provide new services, to really think about effectiveness and efficiency, and really think about any unnecessary duplication or sort of cross efforts. Resources are absolutely needed to address these issues. And so to be able to combine and pool and be strategic about the use of those resources really helpful. Thinking about how challenging this work is. It's difficult work and our energies wane. We get distracted by things like a pandemic. And we really need a sort of a steady drumbeat, energetic message to make sure that we don't lose focus. This takes a lot of communication. Certainly there's concerns about how people view various groups, and we have opportunity to break those stereotypes down, that we can really put our brains together to think about community-wide initiatives and to really think about our clout and our ability to move these things forward so that we are working towards long-term and permanent social change, that it's not just a one and done project that then goes away when interests or funding changes. I'm going to stop sharing my screen. We have just a very short video to share. Patty's going to put this on, and we'll go through that and then come on back.
The number and complexity of challenges facing our world can be overwhelming. When individual organizations attempt to tackle the most daunting problems, success stories are all too rare. Many innovative approaches have been tried, too few have worked. However, when organizations work together under the right conditions, they can accomplish great things. One particularly effective means of collaboration is collective impact. Using the collective impact approach, a number of complex social challenges have been addressed and some remarkable results have been achieved. Youth incarcerations dropped by 45% in just 3 years, with no change in public safety, improving the lives of thousands of youths. 6,000 public housing residents were placed in new jobs during the recession. More than 1,000 acres were restored and over 280 million pounds of pollution voluntarily reduced to conserve and restore a river. Organizations utilizing a collective impact approach do the following: agree to a common goal, agree to track progress in the same way, which allows for continuous improvement, do what each does best while identifying new ways to work together, have consistent communication, and finally, have skilled and dedicated resources to support ongoing efforts. The world's toughest challenges aren't going away. In fact, many experts predict they will continue to grow in both number and complexity. Solving these problems requires a range of expertise from a number of diverse organizations. Collective impact is a proven approach, helping organizations work together to move mountains.
Emma, I think you're muted. Thank you. You think I'd get it by now. So we won't spend a lot of time on this, but just really want to make sure that we are understanding that our intent here today is to, really help across sectors work together towards a common agenda, that we are thinking through ways that we can provide structure to achieve the change that we're looking for, that we are tracking our progress in some meaningful ways, as well as thinking through that communication that doesn't drop off, or kind of leave us wondering what's happening with the other hand. And we will continue to work to recruit and engage cross partners and community members. So this is just a reminder, it was outlined in the video. We're looking for 5 conditions that really contributes to collective impact. The first being a shared vision for change or a common agenda. Shared measurement, so that we agree on the ways that our successes, and in some cases our failures, will be measured and reported, and how we address those pieces so that we can learn and change and improve. That we think about the way we coordinate our differentiated activities, so we have mutually reinforcing efforts. That we are engaging in frequent and structured open communication. The idea of trust being really critical here to ensure that we're really working together and not at each other. And also that there's backbone support to support the initiative and keep things moving. So we often ask, is this just collaboration? And I would venture to say no, that we're really looking to change outcomes, use that data for continuous improvement, make this a part of what we do every day, and fully have the implementation across the community. And so this is, we started to talk in day 1 a little bit about some of the assessments that were conducted in 2020 and 2021. This is some feedback that we received through town halls as we were sharing the mental health and suicide prevention frameworks. And so what we really were interested in learning beyond what the gaps and assets were in the community, and what some of the needs were, especially as we think about a collective impact approach, what is working, and what might be missing or needed some work. And so we saw a variety of things working really well in both counties. For Adams, we saw perceived strengths in common agenda, backbone support, and mutually reinforcing activities. But we also heard in Adams County that there were perceived gaps in shared measurement, continued communication, and that backbone support. So maybe some different perceptions there. And then in Arapahoe County, we heard that there are strengths in common agenda and communication, but gaps in shared measurement, this mutually reinforcing work and backbone support. So just to dive into that a little bit more across these town halls and a follow-up survey, many of you on the call were there and provided this input to us. But we heard that for Tri-County and public health in particular, that sharing data and really examining the disparities and sharing data across systems are a high need. That there's also a desire for convening and connecting, that there's a role for making sure that we are all aware of research-based and evidence-based practices, and the advocacy is happening. And we had some interesting conversation about what's already happening with existing groups in the region, and is there interest in bringing those together or in supporting those that are already happening. And so I think this will continue to be questions that we can use as touchstones for how we structure and move forward with this work. But I think that the quote at the bottom from one of our county participants really underscores why we're thinking about this through the collective impact approach. And from that, so we really understand that we have a role in creating that shared stance and strategy and utilizing the frameworks that we have put forward, ensuring that you all have information around these assessments, and that we're putting some dedicated resource towards expanding the support and structure for collective impact. So just briefly, here are some of the roles for a backbone organization that we can look to as needed for moving this work forward, including vision and strategy guidance, policy, resources, community engagement, supporting those aligned activities, and working on shared measurement practices. So we're going to jump into just the very beginnings of a few of these things today, but just wanted to have everybody have that reminder. We're going to ask you about this later in the meeting, but we're interested in how you see yourself and your organization in terms of partnership levels. So for us to really be successful at a collective impact approach, we're going to want to move our organizations together down the line here from awareness and cooperation more into coordination and integration. And that we also recognize that we all have different levels of influence, and there's no one greater or better level of influence than others. This is just recognition that we all have a role in this work, whether we're helping in the work, we're making connections, we're steering the ship and making decisions, we're communicating through and with our elected officials, that we have professionals that can influence decisions, and those that are providing information throughout the work. So you don't have to remember these, we'll show them to you again, but we're going to ask about this later. So as I mentioned before, we wanted to do a quick review of some of the work that we did on day one. So we'd like to review the themes that were brought forward, and then we're going to break people out into breakout groups, kind of along those themes that we identified. So we'd like to first show you our lovely Jamboard. This is one of the pages. I don't expect anybody to read any of the information on here. But what you can see if you were not there last Monday is that we really looked at areas of opportunity for action and ways that we might leverage some of these actions across the continuum of our frameworks. And so thinking about strategies that might address mental health and wellness promotion, prevention. This red one that's all covered up is clinical and support services, and then recovery, reclamation, and postvention. And what we were able to do post-meeting is to draw out some of the themes that came from this really great discussion to put forward as some actions that we may consider moving forward with. So for those of you who have not looked at the frameworks here lately, Patty, I wonder if you can drop these links into the chat, or I can do it once we get into our breakout groups. But just to remind you that we have our frameworks available to us to use, both the mental health and the suicide prevention frameworks. And before we jump into our breakouts, wanted to review some of the strategies for several of the areas across the continuum. So if we were to combine promotion and prevention strategies, and really looking at the strategies that have been outlined for both suicide and mental health, these 6 came forward as ones to consider in terms of ways to move forward with some of our work. So we would be looking at implementation of programs, really looking at multiple settings to identify and support people at risk for suicide, reducing access to lethal means, implementing communication and education programs, thinking about a policy agenda and a plan of action that address the determinants of mental health, and also improving community connectedness and social cohesion across the community. As we move forward in the continuum to some of the services and support strategies, we're thinking about screening and early identification, integration of behavioral health into additional settings, care coordination and patient navigation, increasing quality and access to culturally relevant services, really thinking about the treatment system, engaging in evidence-based programs and frameworks, supporting the workforce, especially in thinking about interventions, as well as training for professionals across the continuum. And then in our third grouping, we're talking about a collective of recovery, reclamation, and postvention strategies. So thinking about increasing use of programs to reduce reattempts of suicide, developing a coordinated response, and availability of resources and support in the aftermath of the suicide death, both at the family and the community level. Thinking about safe reporting in the media, thinking around clear policies and procedures across systems so that people aren't dropping from one system to the next. Trained and certified peer support specialists. Again, education campaigns, and specifically thinking about mental illness and substance use disorders as chronic diseases, and shining a little bit of a greater light on recovery and expanding access to recovery supports. So that's a really quick overview. But what we'd like to ask you all to do is, yeah, Patty, I see your note. I'm going to put those live links in the chat here in a moment. So we're going to ask you all to choose a group. We're going to have 3 groups, and they will be promotion/prevention together, or access to supports, or recovery, reclamation, and postvention. And these, again, really came through the discussion that we had last Monday. So we're going to ask you all to choose one of the groups, and we'll break out into breakouts, and we're going to do this first activity. So it's okay if you choose a group that you don't want to stay in after today. You might want to be in multiple groups, and we'll ask you to just choose one. And we certainly we'll look for some balance across the groups. So if we have everybody show up in one group and not in another, we may ask some of you to move on over. But once we get into those groups, you will have 2 facilitators that will help you go through the steps of the activity, which are going to be to help us review the frames from Monday, review those strategies that I just went over quickly, and start to organize and categorize and make some connections so that we can start to identify some potential short-term project areas for the next 6 to 9 months. And then we'll all come back and do this work together.
Looks like the room labels didn't come through, so let me real quick fix that.
Okay. And if folks are still here in the main room, we can go ahead and just say that room 1 is going to be the promotion prevention, room 2 is access to supports, and 3 will be recovery, reclamation, and postvention. And if you
Mom,
have
I'm
any,
gonna say
go
this
ahead.
out loud, just in case other people are having trouble, but like I can't get into a room now.
okay,
I had the same issue too.
I'm trying to fix that right now.
Okay, cool. Just
thank you all for your
Thank you.
patience as we're hanging out here. You know, Patty's like the wizard behind the curtains here, getting us all where we need to go.
I would, okay.
Are you seeing the titles now and options to, okay, great.
All right, so are we set to go ahead and choose our groups?
Some of us were in group and then got bumped out.
Okay, sorry about that. Thank you all. Here's our good times navigating the Zoom world. Patty, is there anything that the folks that are still waiting need to be doing?
Not that I know of. It looks
Okay.
like maybe some people won't be able to join a group, but right
Okay.
now we have 15 in promotion, 11 in access, and 7 in recovery postvention.
Okay. Let's do, so for the folks that are here, can we assign them? It looks like maybe we can assign them. I'm going to go down this list here and see if it works. Arturo, if you're on, is there a group that you'd like to join? I may just send people there. Is this working to send people there?
Yes, I think. it
Molly,
looks
where
good.
would you like to go? Okay. I think Heather and John, are you still here in this room with us?
Heather's going to join one in a second.
Okay. Okay. Looks like we're probably okay with what we have here. Patty, am I good to go and check in on the groups?
I think so.
Okay. Let's see what I can do. Okay, welcome back, everyone. All right, well, thank you all for jumping into that activity. I'd like to see if we can just do a brief, like 5-minute reflection from each of the groups. And I imagine, based on my observation just popping around, that we were just starting to get started with some really good work here, and that's okay. Just want to let you know that these are complex issues. It's going to take us a while to really start to identify those patterns and do the prioritization. But I'd love to hear from each of the groups about where you landed. And then when we come back from our break and get ready for the next breakout session, we can talk about where it makes sense for us to pick back up. But I'm hoping each group tagged somebody to be the speaker. But I'll start at the back of the list instead of the top of the list. Does the recovery, reclamation, postvention group want to give us a quick report out?
Thanks for that, Emma. And thanks for going backwards. And we didn't really identify someone to report out. So I'm going to go ahead and jump in. But we had a good kind of just introduction and discussion around some of the activities that were proposed from the summit on day one. And we're able to kind of redefine a couple of them and rethink a few of them. And some of them really kind of rose to the top as fitting many of the strategies that were listed on the page. And so I think we're going to need to dive a little bit deeper into that and think through how we represent those across the strategies, and or if there's opportunity to create a new strategy within that as well. We had a couple small action steps identified just as we were pulling and matching these activities to the strategies. And so we're going to dive a little bit deeper into that, hopefully during our next session.
Great, thank you. How about the Access Supports Group?
Hi, Emma, this is Laura Dunn. I'm happy to kind of talk through what our group did. Lots of great discussion. We were able to kind of divide or identify 4 different groupings of the strategies that the group identified last week. One being sort of existing resources within the community. So things like telehealth, that kind of service or those kind of resources. The other being increasing sort of provider training or figuring out how to increase training. One also being sort of sharing of information between systems. And then the last one bucket sort of fell into more like reimbursement, insurances, and kind of looking at strategies there. So we did not get to identifying action items yet, but I look forward to moving in that direction with the group in our next breakout session.
Awesome, thank you. And then the prevention promotion group.
Yeah, so we were in the middle of a very passionate discussion when we got sucked back to the main room talking about education and especially within schools. And so I think there's definitely something resonating for the group around the piece of bringing education to schools and evidence-based curriculum and understanding consistency in that across multiple districts. So I look forward to diving more into that in the next breakout session with the group. I think the 2 other things I would highlight is there was a couple of requests around rewording in terms of thinking instead of underserved, reframing that as under-resourced communities. And then the other one, which I also appreciated, was instead of common language, is to ensure that we have equitable language around suicide. So taking into that piece, that consideration, especially around language justice and how individuals access education or what is available to them in different ways.
Awesome, thank you. Well, thank you all for engaging and starting to get into a place of wrestling with some of these issues. I think we'll definitely have lots to build on. I would like for us to pause to take a 10-minute break. My clock says 10:27, so I'd like everybody to come back. Sorry, 2:27. Wish it was that early in the day. Oh my goodness. So 2:27 start, come back at 2:37, and we'll go ahead and get started again. And thank you all. Take care of yourself as you need to. Some of us will hang back. If you have any questions or needs, let us know. Okay, well, come on back. Give everybody a few moments to come back to the meeting. Thank you all for taking some time to take care of yourself. Always important to do during these long meetings. I wish I had snacks to give you from through the Zoom world, but hopefully you took care of yourselves there. So let's come back to the meeting. What I'd like to do is go very fast through the next section of our presentation with the idea that we can get right back to our breakout groups and continue some of the work that we were doing together. So I think the way that the rest of the afternoon will go is that we'll keep doing that work. We'll pepper in a few bits of kind of information, reminders around what we're trying to do together. But I really want to make sure that we maximize the times that you all have together in your groups. So I'll go ahead and get started here, and we'll try to make this quick. Again, slides will be available after the meeting if you want to revisit the content. So hopefully this looks familiar. We talked about it earlier. I just wanted to reorient us to the idea of a common agenda. And so if we think about a common agenda for a coalition or a network across sectors, we're looking for a clear problem definition. We have a common vision. We have a population level goal that goes beyond unique programming, and that we're operating on a basic theory of change. And that building a common agenda is really about building common commitments, that we are reaching out to our community continuously and throughout. Hopefully we're really evoking and utilizing our curiosity and our creativity, and that we're taking the time for broad engagement. So to the point of our time today, this stuff takes time and definitely is not something that's going to be one and done. So if we think a little bit more closely at the common agenda elements, we have 5 proposed here. Things like our agreed upon principles, that we've got that problem definition, that we have spent some time defining a population goal, that we're using that framework of change, and that we also have ways to learn about our work together. And so I know through the assessments and the various steps that we've had throughout the engagement with you all over the last couple of years, we've looked to a variety of examples and ways that we might model our work going forward. And so we wanted to just put forward an example that we might consider thinking about. So Laura Cinconi is the coordinator for the Douglas County Mental Health Initiative. I'm pretty sure I saw Laura on. If you're here, if you'd like to come forward, we thought we'd offer an example vision statement from the Douglas County Mental Health Initiative.
Yeah, hi Emma.
Hi.
So do you want me to just talk about where the vision statement came from, how we reached this statement?
Yes, absolutely.
In 2018, the Mental Health Initiative, which is a community collaborative of over 40 organizational partners with somewhere around 15 agencies, sector representatives, went through a process to develop a blueprint for a community-based mental health delivery system. So we had been, as an initiative, spending a lot of time in the crisis area of behavioral health, mental health, and substance use disorder. And from that, our learnings from running a co-responder program really wanted to step back and take more of a system level approach to changing, adapting the behavioral health system. So this vision statement was created by that collaborative of 40 organizations. We took several work sessions to develop it. It was based on feedback that we were hearing, themes that we were hearing in key informant interviews from initiative members, breakout groups, kind of like what Tri-County has been facilitating for this group. So we would come back to the initiative and propose various statements. This one is really, really chock full. So there's a lot going on in this vision statement, but we call it our North Star. It is what we look to. It guides the decisions that we make in the initiative, the projects that will begin, and then how we work together on those projects and how our goals are framed. That's kind of how we've used the common agenda and creating a vision statement to guide our work as a part of the mental health initiative.
Thank you, Laura. I really appreciate you sharing that experience. And, you know, I think a couple of things that resonate as I, you know, hear that history again is the, you know, the iteration, the iterative process of defining and refining based on context and environment, as well as perhaps the interests of those partners working together. And also that this is something that takes time to build from the beginning. So while it's a lot of words together, that there's a lot of meaning behind these words that drives the work. And so I will probably relieve all of you to say that we're not going to try to draft a vision statement today, although that is something that I think we would like to engage you know, members of this group to do over time. So this is an area that we think we would like to start to begin building so that we have that North Star to point to as we engage in various shorter term projects or think about ways that we want to organize and structure. But in the short term, if we think about the elements of building a common agenda, you know, we do some of the things that both we've talked about and that Laura mentioned. So bringing together individuals from a variety of sectors that are critical to the success of the collective impact work, that we look at implementing a broad-based community engagement strategy in order to hear from a variety of elements of our groups. The next step is to develop short-term action teams and thinking about 6, maybe 9 months in order to implement some early win strategies. And parallel to that, forming a team, and this may be a steering committee or some other, you know, naming of that group to begin to work together for a longer term period to ensure that we have ownership of that common agenda, really develop out the shared measurement, and then to be able to share that strategy with others throughout the community. And so this is just a reminder about where we're at in this process. And so if folks are getting anxious or wanting to have more of these parts done, I understand and also just appreciate your patience as we think about moving forward into steps 3 and 4. So I think I'll just go through this very quickly and we'll come to this again a little bit later, but I wanted to put forward the idea that as we continue to do our group work, that we're moving towards building some quick win plans. So thinking about some concrete actions that we can work on at a time during our process when we're still forming some longer term commitments. So we're looking to choose ideas where we have a strong champion, that it is in a time frame that we can really tackle within the next 6 to 9 months, that these are places where we can test ideas and also practice our implementation and working together. So this is really where some of the trust and working together comes through, in that we begin to see how we can support each other. So I'm going to go back here and stop sharing and propose that moving forward, we go back to our groups. I think we have another 15-minute chunk to be able to go back to our first activity and be able to do that ongoing work. We'd love to have some concrete actions from each of the group to consider, and we'll reconvene and then move forward. I see a question about the common measurements, and we are going to be talking about that in our last presentation section.
Hi, Emma.
There we go. There's the mute. Hi there.
Hi. I'm so sorry I haven't been able to join earlier, but Doug Muir, who I think is still on this here, let me know that this was going on, and I think sent you an email that I'm sure you haven't seen. Facilitating
Just sent me
all
a
this.
chat and said there's something in your inbox, and I have not.
Yeah, I
looked at
didn't
it.
hop in
Like
because
if I get a squirrel, I'm gonna get lost here.
Yeah.
So
Yeah, absolutely. I just wanted to introduce myself. So I'm working as a school mental health consultant supporting districts across the state, and I'm working with Centura on a school mental health, a Colorado-based school mental health community of practice that could potentially be of interest to some of the folks on this group. So just wanted to connect with you, introduce myself. I thought it would be easier to do that real quickly here than via email, and we can certainly connect over email when you're not facilitating a massive summit. So
sounds great. Thank you so much,
Yeah.
and it's great to meet you. See you in well on the screen, anyways.
yeah,
And yeah,
Good
I'd
to
love to
meet you.
follow up. And I think some of the other folks, hey Doug, that we have across the Tri-County team. So our maternal child health program in particular has a social emotional priority area that they're working on for that MCH grant. And so there's a lot of interest in partnership with schools around that. And so Meredith Henry and Jesse Reeder, who have both been kind of helping out with some of the facilitation today, I think it'd be great for us all to get together and just really
Great.
see how we can support each other. And I would definitely be super open to ideas about how we can make sure that we're channeling partners that are showing up here to the right resources so that we're not recreating or spinning our wheels on things, and just making sure that we're staying really aware of other areas so that we can focus, where it makes the most sense, where we can fill in some of those gaps. But
Absolutely.
schools are such an important arena. I feel like there's always more to do.
Yeah.
So I'd love to hear a little bit more from you about how we might be able to support some of your work too.
Great. So when you're all settled and done with this, I'll send you an email, just connecting you and me and Doug, and then include whoever you think makes sense in that conversation. And we can just chat about our efforts and how there might be some alignment.
That sounds awesome.
Okay.
Well, Doug, you're
I'll
on
get
mute.
I'll get out of your hair now. I
and,
know
and
you've got a
yeah,
lot
you don't
to
have
deal
to
with.
chase me down, Sarah. You can get connected. But Emma, the great thing is, although all the COP work, it's all of the sessions have been videoed, and all of the best practice information, like national and local, is on a site that Sarah has created. So
That's
people that
awesome.
haven't plugged in, that want to, get connected and see what's been going on, can. And we're working on funding it in another year. So we're
Great.
hoping it's going to continue because there's tons of need. So
Excellent. Thank you so
keep the
much.
boys up.
All
That's
Nice.
why I didn't jump into the work groups. So
That's
thank you
fair.
guys. Take care.
Okay.
All right.
Bye.
Thank you.
Nice to meet you, Emma.
Yeah. You too.
Take care. Good luck with the rest of this. I know how hard it is.
I know it's like herding cats, but it's such important work. So we
I
have
know.
such great minds together. We just,
All right.
we need more time for it. So
I know.
thank you.
All right. Okay. Take care.
Bye.
We'll be in touch. Bye.
Patty, since we have this moment, I know it's still being recorded, but just wanted to let you know, I talked with Callie back behind the scenes, and I think we're going to skip her activity part, just so we have more time to get into the second breakout. So I'll be trying to kind of readjust the timeline so that we can make sure that we have a good chunk of time to do the second breakout, and we'll just skip the third one.
Hey, sounds good. Thanks.
Okay, thank you. All right, welcome back, everyone. It's always cool to see the faces start popping back in. So great. Hopefully that was a good use of a 15 minutes to kind of reorient to the actions and projects. I popped in across all three of the groups, and there were just really amazing, wonderful conversations and questions being asked and ideas being bounced around. It's very, very exciting to just see some of the excitement and synergy here. So as promised, we're going to kind of pop in and out of you want to go back to the group? Yes, we're going to go back to the group here in a little bit. I do want to give Callie Preheim an opportunity to just do a little bit of education for us around our shared measures. I know that's been a question that's come up throughout the day. And so we will have a little bit of moment to learn from her, but I think we will have a good chunk of time to really spend back with our breakout groups, and then hopefully bring that all back together as a group so that we can kind of do some sense making with where we've been and where we think we're going. So thought I was all ready to go. And of course, I have too many things open on my screen. Okay. All right. So I think all groups at least started to get into our impact and feasibility analysis. So this will be something that we will come back to. I did want to just flash this really quickly as a reminder that sometimes it also helps to think about the timing of when we might categorize some of these pieces. Is it something we do now? Is it something we do soon or next, or things that we may, pick up later or do later? And so those are our instructions, and I will hand things off to Callie. So Callie Preheim is also with our planning and information management group, and she's put together a nice presentation for us on developing shared measures. So welcome, Callie.
Thank you. Thanks, everyone. Okay, next slide, please. So I'm going to go through this kind of quickly. I don't want it to overwhelm you. We were, I think, going to try to do an activity where you started to think about this, but the conversation has been so good in the other activities that we're going to wait on this. And I think that makes sense anyway. So really, this is just going to be kind of to get your mind thinking about data. And then as you get further into your plans, we can come back to this. Okay, so there are kind of three areas of measurement we're going to be talking about: structural metrics, process metrics, and then outcome metrics. And I'm going to go through these in a little detail. Next slide, please. Okay, so why do we measure our work? I think some of us either really love this or we just hate it. And I like it. And I think, it makes a difference for a couple of reasons. It helps us define our goals and objectives and just be really clear about why we're doing what we're doing and what we're actually trying to accomplish. We specify what we're doing to reach the goals and objectives. So after you're clear what you want to do, then it helps you kind of clarify what you're going to do to get there. And also, if you use a tool like a logic model, which we often use, it helps you kind of think through, like, why do you think what you're going to do will get you where you want to go? So you can start to think about, like, maybe the evidence base or the experience behind the different activities. It helps you determine if your work is making a difference and if it's making the difference you want it to make. And then it helps facilitate information and data sharing. Next slide, please. So when you look at it from kind of more of the collective impact approach, there are two different kind of parts that you can piece it out into. One is more kind of the performance measurement system, which looks at kind of what progress an initiative is making. And that tracks more kind of the performance indicators, which are more of like the structural and the process. So structural, we'll talk about more, but that could be like, how is the partnership working? Is it doing the things together in an efficient way? Is it high functioning? And then the process are like you would think of a process. So the different pieces of what you're doing and how do you how do you measure what, that you're doing what you said you would do? And then the evaluation metrics are more of the like how and the why the initiative is making progress. And these are what we usually refer to as outcome indicators. So these are more of the indicators that Adam went through at the beginning of the day, looking at, what is the actual like health outcomes related to mental health, and are we shifting those, or if not shifting, are we at least tracking them? Okay, next slide, please. Okay, so just a quick overview again, for those of you who aren't used to kind of talking about data or measures. So outcomes are changes or benefits resulting from activities and outputs. So you can have short-term, intermediate, and long-term outcomes. This is especially helpful if you do have kind of I would say a bigger goal like this. I mean, when you're working on something as large as mental health and suicide prevention, a long-term outcome might be more something like, reduced youth suicide mortality, whereas a short-term outcome could be something that you would expect to happen in the more short term, but that eventually would get you to your longer-term outcome. So it's related. And then the indicators kind of provide evidence that a certain condition exists or certain results have or have not been achieved. So these are, again, more like more the things like if, for example, if you said you were going to hold a conference, did you hold that conference? How many people came? So those are more kind of like counts, or yes, we did this, or we're in process of doing this, that will help you achieve those outcomes. Okay, next slide, please. Okay, so thinking about structural metrics, and these are kind of how do you evaluate or try to measure the structures that support the work. So examples of these kinds of things can be partnership. So around like the partnerships that you form for each of these 3 areas. So was the common agenda developed with a diverse group of partners? That could be something that you might look at. Were members of the target population brought into the discussion? Did they help shape the common agenda? Is the partnership functioning as you hope it will function? Like these are all kinds of maybe more simple, but still important things to think about as you're setting up your next steps. How are you going to kind of track, or what are the kinds of things that you need to know that you want to, let me reframe that. So what are the kinds of questions that you can ask yourself to figure out if the group is set up in a way that makes sense for your purpose and that it's doing what it said it would do? Some examples for structure here could be that you have a clear leadership structure and that you've identified the backbone agency, commitment to the vision. So hopefully that gives you kind of an idea of what some ways to look at structural metrics. Okay, next slide, please. And then process metrics, again, are measuring like the processes that you're going through in the plan. So are you doing what you said you would do? These can be things like how you measure activities or actions. So as you're starting to identify action steps, you can break those down into like different measures. So that will tell you if you're actually doing what the action says to do. So they could be things like you've developed a collective plan of action, that the action plan specifies partners for each activity. And then, from there, it could be, are the partners actually doing that activity? Are they doing it on time? Are they doing it in the way they said they would do it? Partners, let's see, are they using the plan of action? Are they updating the plan regularly? Let's see, partners are coordinating their activities. So you're sharing the progress on the action plan regularly. And then you could have something else maybe that follows that says, like, after you share your action plan regularly, does that lead to different decisions, or is that leading to, reshaping the partnership in a way that makes sense? If that's what you kind of find as you go through that process. These can also be things like I mentioned before. Say part of your activity is to have another summit like this. in 6 months' time. That could be something that you measure. Maybe you want to invite more members of the community, or kind of more of the, the target population. You could say, you could have a goal that you want to include a certain number of groups, or, you want to have maybe 50% of the participants be people from the community. That could be something that you easily track that relates to your overall goal, that would be considered a process metric. Okay, next slide, please. And then outcome measures, again, these look more at, are you making the difference that you hope to make? Again, these can be kind of short-term, intermediate, long-term. So they can be everything from, like I have here, population health measures from different surveillance systems like the BRFSS and vital statistics. These are things that you saw earlier today from Adam. We get these data kind of in different, so unlike the process measures, which you'll be able to collect really as you go, or at whatever pace you set up, some of these you'll have to keep kind of in mind what the frequency of these other data sources are. So some of them are only collected annually or biannually, like the Healthy Kids Colorado survey data that we looked at for middle and high school students. Those are only done every 2 years. So that, while that's a good measure to kind of keep in mind, that's going to be something that's more difficult to use if you want to measure a 6 or 9 month project. And then there's also continuously collected data. So these are things like suicide rates over time. So vital statistics data are death and birth data. So we obviously get death data continuously. You could look at that maybe by month. We typically, I think month is probably the smallest period of time I would look at. Although if you are familiar with some of the mental health reports on Tri-County's website, or you get the surveillance reports that Yoshin Chen and her group put out, you might see that we also have those by day sometimes. And then hospitalizations related to mental health. So those could be ER visits or admissions. Again, those come in regularly as well. So that might be another way that you could look at data more on a day-to-day kind of basis. Okay, next slide, please. So I think, as you get farther along into your groups and starting to think about data and measurement for the activities that you suggest, these are just some questions that might help you kind of plan. So, what are you really trying to do? So you want to be very clear about your goal, who's working on it. So identify the different folks who are involved in that goal, and then who's doing what, specifying roles related to partnership structure. And all of those three will kind of help you start to think about the outcome data, but get to more of the structural and the process measures. And then you want to think about how will we accomplish our goal, both kind of the structure of the partnership. So how can you evaluate and measure the work that the partnership is doing together? And then the activities, how will you tell if the activities are being accomplished as planned? And then how will you know if the activities produce the outcomes you desire? And I don't think we have time for the group activities. So hopefully this helped kind of get your mind thinking about ways to think about data without totally overwhelming you. But our team is here to support you moving forward as you get to the place where you're going to start thinking about this again. So I think that's it. I haven't been monitoring the chat. Are there any questions?
Thank you, Kelly. Yeah, I don't see any questions in the chat, but we can pause and just see if anybody wants to put some in the chat or just speak up while we have Kelly here.
Can I speak up for
Yes, please.
something? So some other things I think are really important that we could be looking at that are measurable things, which is like truancy, expulsion, school violence, those kinds of things that are those are all data that we're collecting to our schools anyway. How are we affecting those measures? But then also within any programs that are at the school, making sure that there's pre and post data that is empirically proven models using like Pittsburgh Sleep Index and other measures that have been proven in measuring anecdotal measures of anxiety and depression and all those things. And there's already set measures. I'm happy to share with you what those models are, but if there could be consistency down the line, it could all be done on a Likert scale, and then your data person could present that all pretty easily.
Yeah, those are great. So, and I think, you know, you at the school district level, you have access to some of those data that we don't have. So that would be a great discussion for the group to talk about how do you share data, who has access to what kind of data, and what would be most meaningful for the group.
Great.
Those are all, yeah, great examples.
Yeah, that's a great point. And when we go back to the language of collective impact, when we talk about shared measures, again, a lot of it really is about how we do the work together. But there is an activity for us to do that is about sharing data from the perspectives of which we represent or have access. And so, you know, the partnership can be a nexus for sharing and, you know, really kind of thinking through how we access and make the review and analysis of that data meaningful for the community. So that sounds like another great breakout group to do in a future summit sometime. But yeah, I love this conversation. I see a couple of things here oh, Molly needs to leave us. Thank you, Molly. Thank you, Callie. Really appreciate this overview. And again, these are all principles and concepts that we'll come back to over time. But just, you know, really find it useful for us to ground ourselves in you know, some of the knowledge and resources that we have. Greta, I see your hand raised.
Yes, and now as I raised it, I realize this might be a little premature, but for our next breakout session and through what Callie just described, are we doing that data exercise for each of our prioritized action items? Or what is the ask using this really great framework? Thank you, Callie. But just curious, given the time frame and the ask, I want to make sure I am clearly set on what we're doing.
What a great segue. Thank you, Greta. So I really think that we were pretty ambitious in thinking, you know, about how many activities we could do today. And so what I would like to propose for this group is that we go back to our breakout groups and really go back to the 2 previous activities and make sure that we have time to continue to flesh out those ideas, do that impact and feasibility analysis, you know, ask questions, you know, generate more ideas. I think we can come back in, let's see what time it is, 3:20. I think we could come back at 3:40. Or 3:41, Patty, and kind of compare notes from there. And we'll pause on the data activity and do that at a future convening. Does that sound agreeable to everyone? Okay, I see some nodding heads and folks that I can see. So we will see you again in about 20 minutes. Thank you all.
Lisa, I don't know if you're on, but the recording stopped.
Yeah, I just, okay, I'll start it again. I paused it while everybody was out.
Oh, okay, thanks.
Okay, welcome back, everyone. We are in the last stretch of our very long meeting today, so thank you all for hanging with us. I'd like to just maybe take 5 minutes to let the groups report back. It's okay if what you have talked about is not fully formed and perfect. That's to be expected, but I'd love to have us all just do a little bit of sharing about what we talked about, ideas that maybe came forward for us to start to consider for a short-term action team. And then I'll do a very quick wrap up, and then I'd like to give the last few minutes for you all to fill out your survey before you leave us so that we can do our important data collection, and also have some direction for following forward with commitments. So let's have the groups report back. Let's start with access this time. They're right in the middle all the time.
I can.
Oh, you go, Laura.
Greta, do you want to jump in?
I don't care.
Our group had a lot of really good conversation. I would say a few things sort of rose to the top in terms of potential areas to work. So there's a lot of work going on throughout the state around sort of care compact models, some model sharing of information in an effort to get folks to where they need to go, and sort of centralized care navigation kind of came up. So that's definitely starred on our jam board. I would say the other area that we had quite a bit of discussion is around universal requests of information, and the conversation sort of was centered around, yes, there's opportunity there to have universal release of information signed, but without sort of that access to care, like workforce and other, resources, that release of information may or may not be so helpful. So we kind of tabled that for now. I think that's all that we got to. Greta, was there anything I was missing? Okay, thank you. Lots of discussion.
Very complex issues to start to parse out. So thank you for diving into that, and thanks to the group members for your contributions. How about post-pension recovery?
Yeah, we had a small but mighty group towards the end, but we had some really good conversation and have some good next steps kind of coming out of it. A lot of it, the conversation really led towards reviewing the recommendations from the child fatality review team and the maternal mortality committee, and kind of identifying some additional next steps with those recommendations, and really involving those team members in this process as well. So that really came out of the group, and Meredith Henry from LPS really shared some great insights that kind of led us down that road as well. We have a few kind of ideas around just identifying some additional like best practices and finding what's out there in terms of supporting a like media and safe reporting of suicide, identifying some best practices for connecting schools and hospitals within this sort of discharge realm, and seeing what's out there and how we might be able to support that connection, as well as some kind of longer term projects, thinking through what a community level supported response looks like, seeing what models are out there, and identifying what other partners need to be at the table in order to really think that through. So I want to thank my group. We had some really good conversations, and we made it through. So great job, everyone.
Awesome, thank you. And then the promotion prevention group.
Again, another great conversation. We dove right back in again, and I think it highlights the importance of collective impact and sort of understanding all of these pieces that are happening across many partners and organizations, and how do we connect all the dots around this, and how do we understand and identify that those in the community, as well as in more traditional organizations that are doing this work, connecting those, especially in the community, with funding opportunities, really being clear and cognizant of representation in the education, that it's not just about the science, but it's also about the heart, that you see yourself represented in the people who are talking about these topics, and then making those connections to others for other topics such as gun safety, inviting the community in and collecting stories, and shared lived experience, storytelling from youth leaders. Also recognizing we need to be creative in where we're accessing and capturing youth and adults, that we can't always be thinking about school as an easy place to access youth and parents. Being cognizant of needing to provide health and wellness support for teachers and adults so that they can be in the best place possible to serve as trusted adults for youth. And I think those were a few of the big things that we talked about in the group.
Awesome. It's a lot. It's a lot, across all of these groups, a lot of wonderful ideas. It may also feel a little bit overwhelming to think about where we start. But I think that that's really what we're here to try to provide some support around. And so I'll just, I'm gonna let you go. Okay, my computer's done. So I'll just talk here. So I think, there we go. So some of our next steps, we see that there's momentum, there's interest, and probably some real need for some coordination for future work. So we're proposing that we put together a steering committee, and this will be a team that will work together for 12 to 18 months at least, that will really start to pull together those pieces of the common agenda and our shared measurement. And in the meantime, we'd really like to get, I love how the acronym worked out here, our STAT teams for short-term action. I think that there's some ideas that were generated today, and opportunities identified last week that we can leverage and probably start to get some work going soon. And then sort of the third tier of engagement is really just to keep this robust network of partners committed and keeping some communication going, making sure that you all know who each other are, and what kinds of resources and supports you can offer to each other. And so those are our ideas for moving forward. And so then the last bit that we have here today is gathering some commitment from you all and getting a little bit of information from you. So we have, some of you may have met Courtney, who is an MPH student at the Colorado School of Public Health. She's been doing some of her capstone project work in support of this effort. And so she put together a great little survey for us to take. We will also email this out, and would love to get as much feedback as we can from folks. But since we have just a few minutes left and we're probably all, feeling tired, after a really intense meeting, I invite you to take these few moments to complete the survey, and then know that we will be following up based on what we hear from you all in the survey, and through some other communication channels. So I just really want to say thank you for taking your time today. I felt and heard a lot of passion and interest in collaboration and connection. And I think I just really appreciate you all coming to a space where we can start to make some of those connections and move some things forward. So I'll be quiet for a bit. If we want to hang out on the Zoom here to do the survey, that's fine. If anybody has any last words or questions or things that you might like to share, we can also do that here. And it's also just okay to type and think about the survey. While you all are typing, I think I'm just going to go ahead and say a goodbye and a thank you so we can stop our live stream and we don't have to record that. But I do just want to say thank you again for all of your effort and time and for your partnership. It's so great to see many of you. I see some faces that I haven't seen in a while and some new folks too, and it's just really exciting and energizing to have this group to come together. So I hope you enjoy your Monday evening. Stay warm. My daughter told me to walk like a penguin today so I don't slip on the ice, so I'll pass that forward.